Good afternoon, everyone. This is Dr. Moreau with Kozele Call. As always, every Sunday at 3 p.m., I'm going to be with you live to talk about school topics and each topics that also have to do with mental health. So, as always, I'm going to invite some of you, and then I'll go ahead with today's presentation. A few more invites, and then I will get started. All I'm asking you to do is once you have the video, please share with your friends so that way they can also benefit from this invaluable information. All right, so today I want to say again good afternoon. As you know, we have a hurricane coming, so I hope you guys are being careful and being prepared this week as we are expecting Milton. Jeudi a une information qui est très importante, je vais parler avant que m'entre dans mental health sujet jeudi. Il y a un programme qui est le Project Upstart programme. Je dis ça en créole, c'est parce que c'est pour plus haïtien que je dis ça. Parce que depuis ou entrer dans le programme Biden, ou automatiquement qualifié pour programme ça. Programme ça, c'est un programme qui est des élèves avec Boss Passes, il y a des élèves avec RAD, il y a des élèves avec manger, il y a des élèves get admitted, jeune admission dans le collège, tout bagay ça yo. So, ou même qui rentre dans le programme Biden, dans l'école ou capable parler avec conseiller, ou bien capable parler avec un social worker, de programme ça qui est le Project Upstart programme, parce que ou automatiquement qualifié pour lui et bénéfice que li ba yo ou pas doit perdu bénéfice ça yo. So ou même qui na elementary school, qui gen ti moun na elementary school, ti moun na middle school, ti moun na high school qui rentre ce programme Biden nan, yo automatiquement qualifié pour Project Upstart. Aller dans l'école ou parler avec conseiller ou bien parler avec social worker qui dans l'école là pour capable bénéficier de tout et bénéfices que programme ça bail. Et programme ça bail bénéfice pour shelter tout monde qui yo aide jeune caille pour été tout bagay ça. So c'était information ça que me gagné jeudi pour nous sur affaire l'école, parce que il est très important nous connaissons un pile bénéfice dans le système là, et par un petit genre pas un but de bénéfice ça, et même là des fois il y a un but de yo pas profiter de yo pas aller faire ça qui est nécessaire là. So moi-même moi capable de faire pour nous ça, seulement capable de faire c'est ba nous information sur ça, et ou même c'est pour aller dans l'école petit tout, parler avec conseiller ou bien parler avec social worker de programme ça qui est le Project Upstart programme pour ou même avec petit tout capable de bénéficier de lui. So, on va entrer tout de suite sur mental health sujet aujourd'hui. Et deux derniers dimanches, on a parlé de antisocial avec avoidant personality disorder. Aujourd'hui, on va parler de borderline personality disorder. The last two Sundays, we spoke about antisocial personality disorder and avoidant personality disorder. So today we're going to talk about borderline personality disorder, what it is, what are some of the symptoms, how do you characterize somebody, what are the characteristics of somebody with borderline personality disorder, what causes personality disorder, are there any treatment for personality disorder? So let's get going with that. So personality disorder is characterized by unstable moods, behavior, and relationships, unstable mood, behavior, and relationships. So when we say behavior, so people may experience antisocial behavior, hostility, irritability, risk-taking behaviors, self-destructing behaviors, self-harm, social isolation, and feelings of emptiness. So when we talk about mood, we're talking about intense anger, anxiety, general discontent, guilt, loneliness, mood swings, or sadness. And we're talking about psychological. We see people with depression, distorted self-image, grandiosity, or narcissism. And commonly, people also have thought of suicide. So these are the characteristics of people with borderline personality disorder, so which we call BPD. So when we say BPD, we're talking about borderline personality disorder. So some of the symptoms are emotional instability, feelings of worthlessness, insecurity, impulsivity in substance abuse, in spending, in sex, or reckless driving. So if you have somebody who's impulsive in those areas, they have BPD, and also impaired social relationships. So all of these are symptoms of somebody with BPD. So what are the causes? What causes BPD, borderline personality disorder? So they say that it could be genetics. It could be because of your brain structure and function. So when they say brain structure and function, they're talking about problems with your brain development or chemicals in the brain. So the chemicals in the brain, like I mentioned that last time, they usually talk about the levels of serotonin, which is the fluid in the brain. So they also talk about more of the causes, environmental factors such as childhood trauma. It could be childhood neglect or abuse. All of these can cause borderline personality disorder. Social factors as well, for example, being part of a community with unstable relationship can also cause borderline personality disorder. So what are the treatment? Are there any treatment for somebody with borderline personality disorder? In a less severe case, in a less severe borderline personality disorder case, you could use cognitive analytic therapy. You could use cognitive behavior therapy. You could use schema-focused therapy or transference-focused therapy. In a more severe case, they use dialectical behavior therapy, or they use mentalization-based psychotherapy. So how do you determine when do you use this type of therapy? So when you go see a therapist or a mental health therapist or a psychologist or even a psychiatrist, they will do an intake, then they will go ahead and do a treatment plan. So based on the information they gather from the intake, that's what determines what treatment. They create a treatment plan with you to let you know this is how they're going to proceed with treating your disorder. And also that could involve medication. It could also involve hospitalization based on the severity of that disorder. So all of that is done when you go in to see, or it could be telehealth as well, when they do an intake and when they do a treatment plan, and based on the severity, based on the information, based on your symptoms, they decide this is the approach they're going to take. This is the treatment that they're going to do with you And again, based on the severity, they could do cognitive analytic, cognitive behavior, schema focus, or transference focus. If it's more severe, they will do dialectical behavior, or they will do mentalization-based psychotherapy for you. So that way they could help you dealing with that disorder. So again, today we spoke about BPD, personality borderline personality disorder. We talk about the symptoms, we talk about the characteristics. So somebody could be hostile, irritable, they have antisocial behavior, they have feelings of worthlessness, they are impulsive, they have impaired social relationships. So these are really some of these, they have low self-esteem, self-destructive behaviors, right? So they feel empty, right? And we talk about the causes. It could be genetics, it could be your brain structure and function, it could be the level of the serotonin in your brain, it could be environmental factors, meaning when you were a child, you were traumatized, you were abused, you were neglected. So all of these could cause BPD. And then we also spoke about the treatment. So this is really in large what I have for you today with borderline personality disorder. If you know anyone with these symptoms, if characterized by these by what I've just mentioned, encourage them to seek help, because they could be treated. A therapist could help them, a psychiatrist can help them, a psychologist could help them. So encourage them to seek treatment, because often people don't seek treatment. They think it's gonna pass, but there's treatment out there. So encourage them to seek treatment. So this was Dr. Moreau for Causez l'École today. Pas oublier Project Upstart, contactez conseiller l'école là, contactez social worker l'école là, si vous entrez sur programme Biden là. Et même si vous pas entrer dans programme Biden là, sous buzz ou capable toujours qualifié pour Project Upstart là. So li pas pour monde seulement qui t'est entré pour programme Biden là. So on doit pas entrer sur programme là et puis ou toujours qualifié pour Project Upstart là. So, contactez conseiller l'école là, contactez social worker là, gon forme pour remplir, et à partir de l'information mettez dans forme là, c'est ça qui a aidé au venir qualifier, qui a dit au sous qualifié pour programme ça. Et programme ça, c'est pas un programme côté que y a prendre un monde pour y veiller sur monde pour venir frapper porte la caillou. Grand pile monde nous connaît qui peur genre de bagage ça yo. Programme ça là pour aider dans le pays, pour bon manger, pour bon côté pour être, pour bon rad, pour bon espace, so, pour aider à l'école. C'est pour ça le programme ça là, c'est pas pour veiller sur famille ou avec petit tout. So again, this was Dr. Moore for Causez l'École. Stay safe this week as we have this hurricane coming in our area, and I will see you next Sunday with another episode of Causez l'École. Have a great Sunday and be blessed.